Hello, it's Dr. Rhonda Johnson. Today is Thursday, June 23rd, 2022, and today I'm talking about COVID infection and men's health. You know, the COVID pandemic has led to devastating health outcomes across the world. Official case counts now have over 500 million people infected and an estimated 15 million deaths. Now, 3 years into this pandemic, we know that COVID can affect our lungs, brains, heart, blood vessels, our immune system, our gastrointestinal tract organs, our kidneys, our ears, and the male reproductive system, just to name a few. But June is Men's Health Month, and I am talking today about the effects of COVID infection on men's health. But first, a little bit of biology review. In our human cells, the virus spike protein binds to a specific receptor called the ACE2 receptor and uses another enzyme in our cells called TMPRSS2 to activate itself. Now, this receptor and this enzyme are highly expressed in the testes and prostate gland, those male organs that are highly involved in the production of testosterone, erectile function, and fertility. Now for a quick epidemiology and clinical review. Men and women are equally susceptible to COVID infection, but men have a greater risk of severe infection, hospitalization, and are more likely to die from COVID. One source I read gave these statistics. Men are 18% more likely than women to suffer severe disease, 35% more likely to be admitted to the ICU, and 50% more likely to die from COVID. Now, the causes for this are not clear. It's likely it's a multiple list of causes instead of just one, and pieces of this unsolved puzzle may include lower testosterone levels and some comorbidities such as diabetes, obesity, cardiovascular disease, and other conditions. But researchers also say, wait a minute, it's not likely to just be biological. There are social and behavioral factors that may be contributing to this. For example, men are more likely to have jobs in transportation, factories, meat packing plants, construction, occupational risks, which have higher exposure to COVID-19. Men are also likely to be more incarcerated and to experience homelessness. Men are less likely, according to research, men are less likely to engage in hand washing, mask wearing, and social distancing, and that's the cornerstone of prevention of COVID-19. And lastly, men have lower rates of COVID-19 vaccination. Now, you all know that I believe and promote getting COVID-19 vaccines, but I have to acknowledge that males have a higher risk of myocarditis, one of the most serious complications from the messenger RNA COVID vaccines, especially males between the age of 12 years and 24 years of age. Now, not to leave out mental health, researchers have said that the COVID pandemic has had a profound impact on mental health. It may not be a direct result of infection, but more men are reporting anxiety, depression, and PTSD across the globe. And studies have shown that men are more engaged in unhealthy coping mechanisms, especially substance abuse and violence. Now, there is one aspect of COVID that favors men in a good way. It's long COVID. Women outnumber men with long COVID. Some researchers say by 4 to 1. So long COVID is less likely to be in males. No one understands why, but it may be related to the immune system dysregulation. Women seem to be more susceptible to autoimmune diseases, and that's well known. So in closing, COVID has had an impact on men's health. COVID can affect a male's reproductive, sexual, physical, and mental health. My message is one today of concern and to increase awareness. I don't have solutions, but ladies of all ages, please share this video with the men in your life. And men, please get the help that you need. See a doctor for your physical, see a counselor for your mental health or mental health professional for your mental health needs. There's a lot of free online self-help tools and resources that can get you on your way to improving your physical and mental health. And the COVID vaccine can definitely lower your risk of serious disease, hospitalization, and death. Folks, sometimes it takes just one small change to begin a major transformation in ourselves. So I appreciate you watching this message. I know it's a little long, but take care and be safe.